Now we will discuss the last two stages of primary angle closure glaucoma. Okay, these stages are stage 4 chronic angle closure glaucoma and stage 5 absolute glaucoma. As I told you in the stage 2 and stage 3, that in the stage 2 there is the formation of iris bombae. Okay, the fluid accumulates in the posterior chamber due to the relative pupillary block, and it will push the iris and will cause the iris, and a dome shaped iris will be pushed toward the interior chamber angle. This is called iris bombae. So in stage 2 the iris bombae is forming. Okay, in stage 3 this iris bombae, because of the severe intraocular pressure, it becomes ischemic, and it is impossible for this iris bombae to come to its normal position and terminate this bombae because of the ischemia. Now, as I told you that stage 3 is an ocular emergency. Why? If it is not managed in stage 3 is not managed properly and timely, what will happen? This iris bombae, there will be the adhesion between the iris bombae and the peripheral cornea. So they will adhere to each other. Okay, this adherence between the peripheral iris bombae and the peripheral cornea, this is called interior synechia, and it will permanently block the interior chamber angle and will cause elevation of intraocular pressure. The intraocular pressure will be elevated chronically, so it will become the chronic angle closure glaucoma. Now, how will the patient present to us? The patient will present to us with similar clinical features, like if you remember from the primary open angle glaucoma. So the person will present to us with night blindness. Okay, dark adaptation will be delayed, and the patient will present to us with sudden visual loss in the one eye, or sudden visual deterioration in one eye. Okay, or in both eyes. Okay, so with these clinical features, as in the primary, these clinical features are due to the substantial damage of the optic disc and entropy of the optic nerve. Because of the intraocular pressure is elevated, and it becomes prolonged. That's why it will cause characteristic disc changes and entropy of the optic nerve, and will suddenly deteriorate the vision. So the clinical features are similar to primary open angle glaucoma, but remember, in primary open angle glaucoma, we have the fluctuation of pressure. Okay, but in this chronic angle closure glaucoma, there is no fluctuation. The intraocular pressure will be elevated. It will be continuously an elevated state. Okay, so IUP is continuously elevated, unlike the primary open angle glaucoma, in which there is fluctuations in the intraocular pressure. Okay, so how will we treat the condition? First of all, we will do topical anti-glaucomic therapy. Okay, if the patient does not respond to topical anti-glaucomic therapy, such as beta blockers, alpha 2 agonist, carbonic anhydrase inhibitors. Okay, pilocarpine, in this stage they are ineffective. Why? Because the iris cannot be constructed. The pupil cannot be constructed. Okay, so we can use the topical therapy. If the topical therapy fails, then we will apply laser for iridectomy. Okay, and if the laser therapy fails, then we will do trabeculectomy. Okay, in which the interior chamber is connected to the subconjunctival space. Okay, so the last resort to us is the trabeculectomy. Now, if this stage 4 can progresses to the last stage of the glaucoma, which is called absolute glaucoma. Absolute glaucoma is the last stage of this glaucoma and all other types of glaucoma. Okay, so the last stage of any type of glaucoma is absolute glaucoma, in which we have a hard blind eye. There is the complete deterioration of the optic disc and the optic nerve. Okay, and the retinal fiber layer is now the retinal layer. Okay, so there is the complete deterioration of this structure, which will cause hard blind eye, which is usually painful blind eye. Okay, we will have painful blind eye, but it can be painless, okay? Usually it is painful. Okay, and as there is everything is deteriorated, so there will be no accommodation, okay? The accommodation will be lost because the pupil is now in a what state? In a dilated state, okay? So in a dilated state, in the iris has pulled it because of the formation of iris bombae in interior synechia. So we will have non-reactive people, okay? It will not react to light. As to normal light, when we expose the eye to light, it causes miosis, pupillary constriction. This is called pupillary reflex, okay? It will be gone. So we will have no pupillary reaction, no accommodation. We will have painful, hard, blind eye. Okay. So this is the absolute glaucoma. So how can we, as the treatment, the only purpose of the treatment in absolute glaucoma is to relieve pain. Okay. So now the eye is blind. So there is no need of such treatment that vision cannot be restored. Okay. So our goal is to control the pain. For pain, we can get in the absolute glaucoma, we can get topical therapy like in chronic angle closure glaucoma. But they are saying that usually in absolute glaucoma, it does not respond to topical antiglaucomic therapy. So what are the options? We have several options. There is in the retrobulbar region, we have the ciliary ganglion, okay? In this ciliary ganglion, we are injecting alcohol behind. The first option is the alcohol injection, okay? Retrobulbar alcohol injection. In order to destroy the efferent fibers, okay? The efferent fibers which carry the pain signals. We will destroy these efferent fibers by injecting alcohol in the retrobulbar region. The second option to control the pain in this hard blind eye, this hard blind edematous eye, okay, so we can get laser, diode cycloablation, okay. Diode laser cycloablation is the process in which we apply the laser. The laser is applied at this region, at this limbus, okay. At this limbus the laser is applied, which will destroy the ciliary processes and will stop the production of aqueous humor. We can also do cryotherapy, okay. And instead of using laser, we can apply coolness like cyclocryotherapy. So we can do laser ablation and cryotherapy, okay. So these are the options to control the pain in absolute glaucoma. Remember, if still the pain is not controlled, then as I told you, the last resort with us is the trabeculectomy. And if trabeculectomy fails, we have to remove the entire eye in order to, as there is no need of eye because the eye is already blind. So the last resort, if the pain is still not controlled by these measures in absolute glaucoma, we have to remove the eye, which is called enucleation of the eye. Okay. So these were the 5 stages of the primary angle closure glaucoma and their pathogenesis, clinical features and management. I also have prepared notes. I will give you the link in the description. You can go through the notes and can learn more. Thanks for watching the video.